SSS 10-5 cream is used to treat acne, rosacea, and seborrheic dermatitis. It helps to relieve skin irritation caused by these conditions. The cream contains a combination of two drugs, sulfacetamide and sulfur. These drugs work together to stop the growth of bacteria on the skin and have a drying effect that helps the skin shed old cells. It is recommended to apply the cream to the affected areas once or twice daily, preferably after cleansing the skin. This cream is meant to be applied only on the skin. The way you use this product may differ depending on the brand you are prescribed. It's important to follow the instructions given by your doctor or pharmacist. Make sure to avoid getting the cream in your eyes or inside your nose or mouth. If your condition does not improve or gets worse, be sure to inform your doctor. If you experience mild redness or dry skin, it's important to let your doctor or pharmacist know. It's also important to note that this medication has been prescribed to you because the benefits outweigh the risk of side effects for you. Most people do not experience serious side effects while using this medication. However, if you do experience skin irritation or scaling of the skin, it's important to stop using the medication and contact your doctor immediately. It's also important to consult your doctor if you plan to use this medication on raw or broken skin, as there may be an increased risk for side effects in these cases. While it's rare, a serious allergic reaction to this drug is possible. Get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, trouble breathing, signs of infection, unusual weakness, easy bruising, or yellowing of the skin or eyes. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor or report side effects to Health Canada. Before using SSS 10-5 cream, make sure to inform your healthcare provider if you have any allergies to sulfacetamide, sulfur, or sulfa medications. This cream may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, let your healthcare provider know about your medical history, especially if you have kidney problems or cracked skin or open wounds, especially on the face or hands. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also unclear whether the drugs in this product pass into breast milk when applied to the skin, so consult your doctor before using this cream if you are breastfeeding. When using SSS 10-5 cream, it's important to be aware of potential drug interactions. This cream may interact with skin products containing silver, such as silver sulfadiazine. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist to avoid any potential interactions. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much of SSS 10-5 cream and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222. For Canada residents, contact a provincial poison control center. It's important to note that this medication can be harmful if swallowed. Remember, it's important not to share SSS 10-5 cream with anyone else. This medication is specifically prescribed for you and should not be used by anyone else. If you forget to use a dose of SSS 10-5 cream, use it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and continue with your regular schedule. Do not use double the amount to make up for the missed dose. Make sure to store SSS 10-5 cream at room temperature and keep it away from children and pets. Do not flush this cream down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.